how do we go about facilitating the process of financing healthcare? And I want to say that it's an integrated process. It's an integrated process, much more than just the Mount St. John's and MBS and the government, indeed. But when you say the government, it's much broader than that. It requires us to have almost a seamless relationship in terms of how we actually engage. Whether it be we are calling the Ministry of Finance, us calling the PS from the Ministry of Health, Mr. Attil, calling Mount St. John's Medical Centers. I can well imagine that if on my side we're dealing with the financing options for the technicians, the nurses, the doctors, it's actually a much more critical issue, even engaging with the minister. And I don't want us to lose that point. There's a lot that goes behind every person that has to fly out for medical treatment. Whether it be on a weekend, you're getting a message from the minister or someone else that we have a situation that we need to move. No. It means me texting Dr. Duncan at 11 at night or 6 in the morning and expect him to answer at that point. And this is critical because we always have to be on guard. Us engaging with the folks in the finance department of the Ministry of MBS saying that this is not protocol, but let's do this and we will clean this up afterwards. This is critical, and I think that we just need to bear that in mind, that as we build this integrated system that we're talking about, we're not losing sight of what we already have in place. The initial vision back in 1978 looked like something. It evolved into the MBS. What we are seeing now is a new vision or update to that vision, and that vision is being led by our minister. I remember coming back from the IMF World Bank, and I was actually just about to leave. I was about to go to work for Kartak, and the Prime Minister called and said, "Where are you going? We have work here to do. Why don't you come and do some work here?" And I went to the minister's office, and he gave me this speech. He told me that he's, there's not a political statement, but he told me this thing about him coming, being in the US, having opportunities to stay on that side, but making the decision to come back to Antigua. And we had a conversation about where he wants to take the healthcare system and this transformation of national healthcare, MBS into national health insurance. And I bought into that vision. Now, I've made several stops on my career, but I can say and I can testify that this has been the most meaningful part of my career. There's one thing about us looking at macroeconomic stability, dealing with numbers, checking numbers. And what the transformation have shown me is that every decision that you make about increasing a tax or cutting a tax, there is a body that is attached to that. So it shows a transition between policy and service, or policy and how that impacts on people. And at MBS more than anywhere else, I can see clearly decisions that we make, how that impacts on the life of people. Whether or not we are at the Mount St. John's board discussing how we deal with the hospital treatment and care, someone calling or coming into your office needing assistance and you need to move immediately. There's no other place that I'd rather be than here and to be a part of this process. Minister, thank you very much for your vision that you've shared. And I can say, and I think I can speak on behalf of all the other technicians and the healthcare professionals, both at Ministry of Health, in the ministry itself at the Mount St. John's, that we share the vision and we look forward to working with you to actually make this a reality.